Hello again. This is Lesson 5, Part 2, Euthanasia. The term euthanasia comes from a Latin word meaning the good death. The AVMA provides us with all kinds of outlines and parameters that we need to adhere to when performing euthanasia, but they say that euthanasia is a humane method of ending life, which should be done in the most rapid and pain-free technique possible. Euthanasia allows us to end pain and suffering in a humane way. As you can imagine, there is a lot of controversy over euthanasia. When performing or discussing euthanasia, it's not uncommon that you will come across people, pet owners in our pet owner population, who disagree with the act of euthanasia or who think that it might be an inappropriate recommendation to make for our patients. Our job as veterinary professionals is to guide and support our pet owners in the decision-making process and to provide them with appropriate and easy to understand information so that they can make the best and most informed decision possible. This does put an extreme emotional burden on our veterinary staff because it is a very emotionally sensitive topic that we need to discuss with our pet owners. So later in this lesson we will be talking about compassion fatigue and ways that we can take care of ourselves in managing this hugely emotional event that we are required to participate in as veterinary professionals. I think that it would be difficult to find a facility in the veterinary profession that did not support euthanasia. So if you are entering this field with the thought that euthanasia might not be something you want to participate in, know that most jobs for veterinary professionals do at some point require euthanasia participation. The most common and appropriate or acceptable methods for euthanasia are through inhaled gas agents, overdoses of inhaled anesthesia agents, which is more common to be used in smaller animals and can take longer. It can make the euthanasia procedure take longer than it would if we were to use an injectable agent. For injectable agents, we do need access to a blood vessel. So an animal who is dehydrated or has low blood volume or poor vessels, this might make it additionally stressful in placing an IV catheter or gaining vascular access. Although the injections do tend to act faster or have more rapid effect than an inhaled gas would, and our goal is to be able to perform euthanasia as quickly as possible. When we give injections, the most common way to give an injectable euthanasia agent is through an IV, usually in one of the leg veins. We can inject euthanasia solution IP intraperitoneally, which you might remember as being in the space between the organs and the abdominal cavity. That can take a fairly long time to absorb by the body, sometimes upwards of 20 to 30 minutes, depending on the animal's absorption and circulatory rate. We can also give injections IC, which is intracardiac, directly in the heart, which is very rapid onset of effect. Although IC is not the typical method of euthanasia, most commonly used in small animals or laboratory animals. But for most of our pet owner patient population, we will be performing euthanasia through an IV catheter or a peripheral vascular access with direct from needle injection. The euthanasia agents that we use in injectable form are highly concentrated anesthesia agents or barbiturates. We give an overdose of these agents, which reduces consciousness, and as the animal's level of consciousness starts to decrease, as it would if they were going under anesthetic for a surgical procedure, the overdose ends up causing respiratory and cardiac arrest. And once respiratory and cardiac arrest occur, then brain death soon follows. The whole process takes about a minute to a minute and a half on average. During the euthanasia procedure, if there is a comfort room available, it's highly recommended that we employ the use of that room. Now, a comfort room can be a room specifically designated for euthanasia and is only used for euthanasia, or it can be just an exam room that we have designated for that particular euthanasia. We don't rush people out of our rooms when they have euthanized an animal. We try to allow them enough time to kind of grieve and absorb the circumstances before they have to leave our hospital and drive home or possibly return to work. So our job during the euthanasia procedure as veterinary staff is often in a supportive role. We need to make sure that we're supporting the veterinarian through the procedure by restraint, preparing supplies, allowing smooth transition through the levels of consciousness, but also support for our pet owners, which can oftentimes be very emotionally challenging. We place IV catheters in the animals that will be getting in the injection through an IV catheter, or we prep the site for a direct from needle injection. The medication, the anesthetic agent that we use for the euthanasia procedure is very thick and difficult to inject. So slow IV injection is recommended for two reasons. We want the body to be able to kind of smoothly transition through the levels of consciousness, but also for safety precautions. If you inject too hard or too fast with euthanasia solution, because it is so thick, we run the risk of possibly blowing the needle off of our syringe, which can then spray euthanasia solution all over the animal or in the face of the restrainer or the person administering the injection. So slow IV injection is recommended for euthanasia solution. It can take a minute to a minute and a half to take effect. It can take a little bit longer in animals who have cardiac malfunction or cardiac disease. Slower circulation will cause the medication that we're using to be circulated through the body slower. So it will take a little bit longer for level of consciousness to decrease and also for respiratory and cardiac arrest to occur. Once respiratory and cardiac arrest occurs, the injection, if there's still some left in the syringe, the entire amount is then finished, and then the doctor can pronounce the animal as being deceased. There's a website link here for you with the AVMA recommendations on protocols for euthanasia. It's quite lengthy and detailed, but also worth looking at so that you can see what they recommend as being appropriate methods for euthanasia. When death occurs in an animal, whether by euthanasia or through natural causes, the body does experience some physiological effects that pet owners need to be prepared for. The eyes do remain open. The natural position for the eyes is an open position. The body does remain warm. When I first started working in the veterinary field and started participating in euthanasias, I was really surprised by how many people had the perception that their pet was still alive because the eyes were open after the injection was administered and that the body remained warm for a length of time after the injection. Rigor mortis does not set in right away. It can take minutes to hours for that effect to occur, and it doesn't last, so the muscles that become rigid can then relax at a later time. So pet owners think that once the injection is given that their pet is instantly going to feel cold and be stiff, and that is not the case. That's not effects that a pet owner will usually experience because those are long-term effects of death occurring. They don't happen instantly. Because the body is completely relaxed, the animal may leak urine or stool or might have a little bit of vomitus come out of the mouth. If they have some sort of cardiac or respiratory problem that allowed fluid buildup in the lungs, that fluid might leak out of the nose or mouth as the animal's consciousness level decreases. They might go through a period during this process where they have muscle tremoring or twitching, or they might do some what looks like body stretching, where they're stretching their legs a little bit. That's just a nervous system response. There's a normal response of the body, again, that we just need to prepare pet owners for. And then probably the biggest one and the most emotionally difficult effect of death occurring is what we call agonal breathing, or the animal might take some agonal breaths, which looks like the animal is gasping. For a pet owner, they think that the animal is not able to oxygenate well, but these agonal breaths actually are not functional for bringing oxygen into the body. These agonal breaths often occur after respiratory distress or after respiratory arrest has occurred. Most of the time they occur even after the heart has stopped, although they can occur while the heart is still beating. The agonal breaths that do occur, again, are a nervous system response, and it's just the nervous system kind of trying to, is recognizing that the body, that the systems are failing, and it's kind of giving that body like a little jump start to try and restart it, although that won't be possible with the injection that we give. So we just need to warn pet owners that agonal breathing might occur, and that it can be pretty startling if it does. So if they're prepared for it, they can typically handle that circumstance a little bit better. I have to say, as a veterinary professional, agonal breathing is one of the most bothersome physiological effects of death for most veterinary staff as well. It can just be very unsettling to be sitting there with an animal whose heart has stopped and who has been pronounced dead, and then to see them do this agonal breath shortly after that can be quite upsetting. So being prepared for that allows us to kind of manage that situation a little bit better.